There are millions of individuals who experience illnesses on a daily basis. For some of these people, the illnesses are short-lived and will permanently go away with treatment or therapy. However, if you are someone who suffers from a chronic illness, you are continually faced with a long-term condition that has the ability to be treated but never cured. Examples of these conditions are heart conditions, diabetes, mental health problems, neurological disorders, muscular and/or skeletal disorders, asthma, and respiratory disorders. While this is by no means a complete list, these are some of the most common chronic illnesses suffered by individuals today. Although these conditions are some of the most treated illnesses today, none of the conditions mentioned can be cured at the present time. A few characteristics separate chronic illnesses from other disorders. Yet it is important to remember that not every person will experience every characteristic. Some of the common characteristics of chronic illnesses are: 1. A gradual onset of the illness. 2. An increase in the frequency of illness as you become older. 3. The ability of the illness to affect multiple organs simultaneously, which potentially leads to secondary problems. 4. A decrease in the quality of your life because of the illness. 5. Costly treatment and/or therapy for the illness. Now, depending on the type and severity of a chronic illness, there is a potential for these conditions to affect every aspect of your lifestyle. This aspect of a chronic illness is quite disheartening to many individuals. And a large number of people who suffer from chronic illnesses also develop depression as time passes. Depression is actually a common complication of chronic illnesses and has been estimated to affect up to 33% of the population. Many times a lack of self-confidence will be a problem if you are suffering from a chronic illness, because of the symptoms and the fact that you may not always know exactly when the worst effects from the illness will be felt. For example, if you suffer from multiple sclerosis, there can be a long break between the first occurrence of the illness and subsequent episodes. Despite this fact, you may not feel as confident overall due to the fact that you know what multiple sclerosis is capable of doing to your individual body and nervous system. You are the person who experiences the pain of the multiple sclerosis episodes. And you are the person who must continue life on a daily basis until the illness can be treated effectively enough to subside again. Over the course of time, this will often cause problems with a person's self-confidence, because the person always knows the condition has the ability to rear its ugly head at what can be the worst possible times. A chronic illness will also have potential effects on relationships between you and your friends or family members. This is because there are times when some individuals who have a chronic illness are forced to rely on others for support. And it often leaves the person feeling as if he cannot succeed on his own. There is a lack of feeling independent, and this can cause the person suffering from a chronic illness to harbor feelings of bitterness or resentment. It is important to ensure you are handling everything you are capable of whenever possible so that you have a feeling of independence. This can greatly help with the bitterness and resentment during those times when you must rely on others for support. A chronic illness is a condition managed differently than other illnesses or disorders. That is because a chronic illness will never completely be cured. Depending on the type of illness, there are various treatment options available to fight the illness and help you return to your optimal level of health. With that being said, however, it is important to remember these options are only capable of treating the illness and not eliminating it entirely. The person suffering from a chronic illness has the responsibility of following the medical advice of his physician or health care professional if he wishes to remain healthy. Other ways of chronic illness management vary depending on your type of illness. However, it is always a good idea to ensure you get the proper amount of rest and consume healthy foods on a daily basis so you are getting enough vitamins and nutrients to help your body remain as healthy as possible. If you have the ability to exercise, this is also important so you may maintain the proper muscle mass and help your body remain healthy. Often, this will cause chronic illnesses to stay subdued and not become bothersome, because the body can continuously fight the illness due to the healthy choices you are making every day. Now that we concluded the chronic illness portion, let us talk about what acute illnesses and injuries. Let's spare you from the old jokes about a disease being acute disease or having something to do with degrees of angles. For our professional healthcare knowledge, we need to know how an acute illness differs from a chronic illness along with some common examples. An acute illness or injury suddenly occurs with a rapid onset. These conditions tend to resolve quickly on their own or with medical treatment. An acute condition might also be so fast-acting and severe enough that the patient won't survive. A heart attack, for example, is generally a rapid onset, short-acting problem that either results in death or can be stabilized before treating the underlying cause. In a chronic illness, the disease has a slow progression that builds over time and tends to be a long-lasting problem. There can be some back and forth between these two categories. A patient might develop long-lasting chronic disease following a sudden injury, for example. Likewise, a chronic condition might increase the chance of a patient experiencing an acute illness or injury. The term acute can be used to distinguish illnesses or injuries from a chronic variation of the condition. Acute can also be used in common speech to emphasize suddenness or severity, such as referring to an acute case of appendicitis. It's important to remember that acute does not necessarily mean the illness or injury is severe or more likely to be lethal. A broken toe is an acute injury but is unlikely to cause significant or life-threatening complications. An acute illness could rapidly start, but pose more of an annoyance than anything else. Examples. Let's take a look at a couple of examples of acute illnesses and injuries. An illness is a problem of a medical condition or disorder. An injury refers to physical or mental harm that happens to the patient from an exterior source.